Dear students, hello, and we continue the lesson Hospital Planning. It's part 2 for today. Let's start analyzing the case study. Examine the medical report of A&E Accident and Emergency Department of Unicorn Group Limited Medical Center. Describe the report to present it on the weekly planning session. So you have to describe it in your own way, and then we are going to compare it to the sample answer. This is the possible answer. According to the A&E weekly report, there were 5 doctors to perform medical treatment to patients. Dr. Beroskin provided general medical service on the 11th of September. Unless the procedure was difficult, he didn't need any assistance. The patient paid 990 rubles for his treatment. On the 12th of September, Dr. Sargsyan was on duty. He provided dental service to the patient for 2,500 rubles. The procedure had easy level of complexity, and 1 medical worker assisted him. Dr. Mandrikin carried out MRI manipulations on the 13th of September. The procedure was moderate difficult and costed the patient 4,000 rubles. 1 medical assistant helped the doctor. On the 14th of September, Dr. Krugovich was operated on the patient. The surgery was moderate difficult, and 2 members of the operating team assisted him during the operation. The surgery was free to the patient. On the 15th of September, the duty doctor was Dr. Karaman. He made some orthopedic manipulations which were free to the patient, probably because the procedure difficulty was estimated as easy, or the reason was a sort of courtesy for a pretty young lady patient. No other assistant participated. To complete the test file, we have to match the terms to their definitions. Take your time to complete the exercise, and then let's check the answers. Physiotherapy, the treatment of injuries by doing special exercises. Surgery, the treatment in which a doctor cuts into a patient's body in order to remove or treat the damage to diseased organs. A ward, a large hospital room with patients to stay. ICU, intensive care unit, a ward where seriously ill patients are closely monitored. Gynecology, a branch of medicine in which doctors treat women and their reproductive organs. Oncology, the field of medicine concerned with the study, treatment, and prevention of cancer. Neurology, the study and treatment of disorders of nervous system. Let's turn to reading. We are going to read out loud together. There are different hospital departments. For example, number 1. The Accident and Emergency Department provides medical treatment for patients who are admitted prior appointment. This mostly happens to patients who are taken to hospital by ambulance. Number 2. ICU Department provides medical care and treatment to patients who are in critical condition and need to be closely monitored. Number 3. A surgery or an operating theatre is a place where operations are performed. It is called this way because many medical workers and students come to watch the operations. Number 4. In the maternity ward, women during pregnancy and newborn babies are treated. This department is often filled with agonized screams of women in labor. Number 5. Outpatients department or outpatient clinic is for patients who need diagnosis or treatment but do not stay at the hospital for a longer period. It offers a wide range of treatment services. Among them are diagnostic tests and minor surgical operations. You have to choose the best heading for each abstract. Take your time and then check your answers. Now let's turn to grammar and lexis review. We have to complete the sentences with the appropriate word forms. Take your time to complete the exercise. And now let's check the answers. Hospital workplace design is dramatical when it comes to medical personnel comfort and patients' safety. An optimal hospital design minimizes the workload of doctors and administrative staff, but also optimizes all hospital processes. Each hospital department is unique in terms of its specialization and has to be designed individually to combine the necessary equipment and processes into one professionally designed system. But some environment factors are universal for all hospital departments: hygiene, comfort, and flexible work options, which lead to patient and staff satisfaction. Hospital design focuses not only on current activities, but also on future objectives. But the key factor for a perfect hospital design is to optimize clinical workflow and enhance patient care. This is the last task for today, and as you can see, it is closely connected to the state exam format. You have to answer the question, what makes a good hospital plan? And you have to compare and contrast two pictures using the following plan. Give a brief description of the pictures, action, and location. Say what the pictures have in common. Say in what way the pictures are different. Say which hospital would you prefer to work in. Explain why. Remember, you have to speak continuously for 2 minutes. It's 12-15 sentences. And you have to start with the phrase, I'd like to compare and contrast these two pictures. Try to do it yourself, and then let's check and compare it to a sample answer. What makes a good hospital plan? A good hospital plan can be achieved by a special approach combining professional, stylish, and smart design appropriate to current and future hospital needs. Now, I'd like to compare and contrast these two pictures. We can see hospital environment in both pictures with special areas, wards, and design demarcation. The furniture and equipment are typical for hospital environment. Both pictures have common features. They show some hospital areas which are relevant to medical needs and activities. We can see handholds on walls, medical beds and other medical facilities, walls and ceilings perfectly white and clean. But there are many differences to mention between two pictures. Picture 1 shows hustle and bustle of a spacious reception area in hospital. It is light and crowded with doctors and patients interacting with each other. Most people are moving and seem to be very busy. There are no people in picture 2. There is a dark corridor with plenty of rooms and some medical beds along the walls. The twilight or UV lights make everyone sad and depressed. I definitely prefer to work in a hospital in picture 1 and become a part of this angel-like hospital. I suppose I'd never be bored or depressed in such a hospital, as there are so many things to do, so many patients to treat, and colleagues to cooperate with. That's all I wanted to say. It's all for today, my dear students. Goodbye. Have a nice day. See you next time.